Patients who undergo dental implant surgery with 4 sedation report significantly lower levels of pain and anxiety compared to those without sedation. Sedation for dental implants can vary from mild to moderate and to complete sleep levels, with options including oral sedation. A pill or liquid medication is taken before the procedure, inducing a relaxed state but not fully unconscious. Patients are typically awake and responsive but may have limited memory of the procedure. Laughing gas, a colorless, odorless gas inhaled through a mask placed over the nose. This type of sedation helps patients feel at ease and can be adjusted as needed. The effects wear off quickly, allowing patients to resume normal activities shortly after the procedure. Intravenous, 4, sedation, administered through a vein. This form of sedation provides a deeper level of relaxation. The patient remains conscious but may not remember the procedure afterwards. For sedation requires a longer recovery period and may not be suitable for all patients. Dental implants under general anesthesia involve a patient being fully unconscious during the procedure, ensuring no pain or awareness of the process. This option is ideal for patients with severe dental anxiety or complex cases requiring extensive work. Performed by a dental professional with anesthesia expertise, general anesthesia ensures a safe, comfortable experience, allowing patients to wake up with a restored smile without any memory of the treatment.